My name is Tiffany Bankston. I'm a physician assistant here at Genesis Plastic Surgery with Dr. Panchow. I've been practicing for about 11 years. I've been with him for about almost 7 years. I am originally from Oklahoma. I'm born and raised. I went to high school here and college. I did my undergrad at Oklahoma City University, and I moved to Texas and went to PA school down there. I really liked the sciences. Undergrad, I had majored in biology in undergrad. I loved cadaver lab, and my parents kind of thought I was a little weird with that, but I mean, I like the science of it. I like the anatomy of it, and it was something that just kind of came natural to me. I cannot see myself doing anything else but being in the medical field. I thought I would want to go into the business side of medicine, and I went in for my master's, and I did, I think, marketing, and I took a couple of other classes, and then stats came into play, and that did not work out very well. So I thought, you know, my mind does not work like that. So I applied to PA school, got in, and here we are now. Being in plastics, aesthetics, you get to bring out the beauty in everybody. There's different procedures. It's not just one thing fits everybody, so you get to tailor it to the person. I've come to know my patients, you know, on a personal level. I know about their families, they know about mine, so it's almost kind of like we're a family. I enjoy seeing them. I enjoy just throughout the years, just seeing their progress, their growth, not only in the office, but, you know, just kind of keeping up with them outside of the office, you know, on a personal level with them, to see, you know, what vacations they've been on, you know, if they've had kids, if their kids have, you know, gotten married. So, you know, I've been able to, you know, do some procedures just to kind of get them ready for their wedding. I always tell patients, do what you want to do, what makes you feel happy, what gives you peace. I've had some patients that have come in, and it's just as simple as Botox. They've never had Botox before, but they've had friends that have had it, but they don't know if, you know, if they can have it. If I feel like they're kind of sitting on the fence, I just say, you know, we don't have to do it today. Go home, think about it, pray about it, and whenever you feel at peace, you'll know. You come back, we're always here. So, I mean, it's never a pressure situation where you have to, you know, you have to have it right now. And so I think they appreciate us for that. And I've had patients that will come back and say, you know, thanks, I feel, you know, I feel good about this, let's go ahead. They've come to trust me. I have a good rapport with my patients, and so that's the part that I like about this job. There's one procedure in particular. I perform Thermiva, which is a vaginal rejuvenation. So it helps with incontinence and vaginal dryness. So it'll help produce moisture. If there's any orgasmic issues, it will help with that as well. I've had patients that have come in and you know, they've never had an orgasm before. They've got, you know, lots of vaginal dryness to where, you know, it's painful. I think I get a little bit emotional when I talk about it, just because we rate that, and so we have a questionnaire, a pre and post questionnaire. So whenever they come in, it's a basic, you know, do you have any vaginal dryness? It's 1 to 5, and I've had patients that have come in on 1s, and we've been able to get them up to 4s and 5s, to where you know, they've got their life back. And there's a lot of women out there that struggle with incontinence issues. It's almost still kind of a taboo that you don't talk about it, but they're suffering from it. You know, some women come in and they say, oh, you know, I feel bad for coming in, or, you know, my husband, you know, doesn't. And so I always tell them, I said, you know, men do maintenance on their cars. This is just your maintenance, and you're doing it on yourself. You know, everybody sees themselves in the mirror, and, you know, they see something that they don't like. And so, I mean, if it's something that, you know, that you would like to have changed, or, you know, just slightly augmented, I mean, why not do it if they're going to feel better about themselves?